If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 17th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to this show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101, and second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. For today's episode, we have Dr. Marguerite Kotsina, internal medicine and geriatric medicine attending at the New York Methodist Hospital, and Dr. Placido Morano, rheumatology attending at New York Methodist Hospital. Welcome. It's really great to be with you guys. Two of my favorite guests all time on the show, and it should be a great show tonight.
Thank you very much.
Thank you. And Dr. Kotsina came in actually as a last minute almost, as somebody who got ill and couldn't make it, and she's here looking great, so
yes,
thanks.
I'm really glad to be here.
Thanks. And Kirsten, how have you been?
Hey, Dr. Garner. I've been really great. It's been a crazy week.
What happened?
Well, I was in Italy.
Wow.
I was in Italy for my honeymoon.
Honeymoon, what can you tell us about that?
I can tell you it was the best trip of my life, and I ate pizza every day.
Oh, really? That's a
Every
good
day.
Italian pizza. Can you get Italian ices in Italy? What would you ask for?
You get gelato. I didn't even see
gelato,
any.
gelato. It's pretty good stuff. But anyway, it's great to have you back, and now the honeymoon is over, and now it's time to get on with life.
Time to work.
Yeah. Great to have you. What do you have to tell us about the news?
I hear smiling may save your life.
Well, this is true, actually. Now look at Christina smiling. There's two different types of smiles. There's a genuine smile and the stewardess smile, they call it. Pan Am used to make the stewardesses smile at people when you could call them stewardesses, and they'd smile as you got on the plane. You knew they weren't happy to see you, that they had to travel with you for 8 hours, but they were forced to smile. Now, the genuine smile is when you're really happy. That involves the muscles of the mouth and the eyes. The false smile, or the stewardess smile, it just involves the muscles of the mouth. It turns out that both of these smiles can help your health, even the false one. So it has to do with the fact that as the facial muscles change, the brain puts out hormones that make you feel good, chemicals that make you feel good. And it helps to lower your blood pressure, your pulse, and just takes out the stress out of life. So I see Dr. Morano's got the ingenuine, the disgenuine.
I'm trying to, contain myself.
Dr. Kotsina has the genuine smile.
Yes, of course.
Kirsty has the genuine, you have the genuine smile
Yes,
as well.
yes.
I'm hysterical.
You should be a stewardess. But anyway, so you learn something. You're in traffic, smile. So what are you going to do, Dr. Morano, when you're in traffic? Let me just see.
I curse a lot. I thought that was a good thing to
Okay.
express yourself.
Moving on to the next topic in the news. Something about sitting, right? Sitting.
I think so.
Now, it's not, many doctors sit all day, and it has been linked to hemorrhoids. This is true. Sitting and hemorrhoids are linked. But what about diabetes? It seems that diabetes is linked to sitting too long, and you can't overcome it by exercising. So if you sit too much, there's a good chance you increase risk. I don't say you're going to get it 100%, increase risk. What can you do? You should try and stand up every 20 minutes. This is the suggestion. If you get a phone call, stand up when you take the phone call. Different things you could think of. And stools seem to be better than sitting on flat chairs like this.
Wow.
So, interesting, something you never thought of.
I'm going to have to try that out later in the show.
Yeah, you got to try this
It's
out.
an
the
hour
sitting.
show.
I'll keep it watching. We'll have you stand up after 20 minutes, okay? But anyway, so that's sitting. Now, diabetes could be due to a lack of sleep. It seems that when they deprived about half the group got deprived sleep. They weren't able to sleep 4 hours a night. The other group slept 8 hours a night. At the end of a week, there was almost a 10-year aging in the metabolic function of these patients that didn't have sleep. Their body rejected the insulin. It didn't respond to it properly. Their fat cells grew out of control, and they had all kinds of problems. So sleep is very important. Another one that came out, as long as I'm on sleep, kids that don't get enough sleep have behavioral problems at school. And it looked like they needed 27 minutes extra a night of sleep would make most kids behave better. So it's something to to think about. You could actually stand up every 27 minutes with the kid, to help the kid to go to sleep, something like that. We can get some kind of parameter. Any other news you wanted to talk about?
I don't think so.
All right, that was good though. I thought that was pretty good news.
Yeah.
You like that?
Yes, absolutely.
Okay. Now, because we got to go, we got our busy phone line working.
It's true, but you know what? Before we go to the phones,
yeah,
we have our quiz questions.
This is what I was getting. I see. Now let's see what we got here.
Okay, we have the quiz questions today. So, this week marked the 50th anniversary of the Cuban Missile Crisis.
Oh, that was scary.
I bet. This was one of the scariest events in our history, and as we came closer than ever to nuclear war with the USSR. So during this turmoil in October of 1962, people were watching Wagon Train on television. Do you remember that show? I hear it was #1 in the Nielsen ratings, and people were also making $1.25 minimum wage. So the quiz question today is, what was the average cost of gasoline during that month of crisis? Do you know or remember what the average cost of gasoline was? So the second quiz question is, this week also marked the 50th anniversary of the Second Vatican Council. The question is, which pope opened the Second Vatican Council and which pope closed it? Do you know?
Always good questions coming up. But I remember the Cuban Missile Crisis, having to go under the desk at school when they had an air raid drill.
Right.
You go in the cupboard like that was going to save you, from the nuclear weapon.
Well, they know where to find you.
Right. But the weird thing was, they came to my school with 3 different newspapers. So each time they called the drill, you thought this had to be the real thing.
Right.
And they wanted to show, they called them how smoothly kids were responding. And the headline of the New York Post that day was, "War begins at 10 a.m." I'll never forget that. So it was like, people under 50 can't remember this when they weren't there. So anyway, while people at home are reminiscing and talking about their experiences, let's take a break. Now, I want to remind you the phone number is 718-499-6101. And remember, our topics are internal medicine, internal medicine, and rheumatology, and some geriatrics thrown in, okay? So don't go far. We'll be right back. And welcome back to Ask the Doctor. Before we get to your questions, I just want to talk a little bit to Dr. Morano and Dr. Kutsina about some happy events in their lives. And Dr. Morano, you had great success with your children, knock on wood.
Thank you very much.
Tell us a little bit about what Jacqueline's up to.
Oh, Jacqueline finished medical school. She's going to do training in anesthesiology at Northwestern University in Chicago. And Anthony's is very interesting. He's with an internet health company.
What's the name of it?
Huli Health, H-U-L-I Health. Yeah, well, there's 2 meanings to the word. And to find out what the meaning, go to hulihealth.com, and you'll find out the 2 meanings of that word. He's in Costa Rica right now, and they're trying to set up international referrals to doctors and different services that might be cheaper outside the US of A, as well as if you're a tourist or you're traveling someplace and you need assistance. So it's quite a concept. And he's with a group of great guys. So that's Huli Health. And my youngest son finished Georgetown. He's
beautiful.
He was summa cum laude. He's the smartest out of all of them. He's a #1 son, as we say. Remember #1 son?
Yeah. Who was that?
Sorry, Anthony.
Hap Singh?
No, that was Charlie Chan.
Oh, okay.
And he's with the Department of Defense, and he's saving us through means I can't tell.
Fantastic.
And all the contributors to one person. You know who, right?
Your wife.
My wife. Thank you, hon.
And I understand your mother-in-law, but then what happened?
My mother-in-law fell, unfortunately, and survived.
Okay.
I mean, that's good now. That's good. I mean, it's good that she survived. I'm sorry.
All right.
I don't know how that came out, right?
Yeah, we appreciate it, and thank you. And Dr. Kutsina, your daughter.
I have one daughter, Yana, and she's going to medical school. Currently, she's studying for board exams and doing very well. So we are really happy for her.
See, parents work hard. You need a little luck and working hard, and that's what you get. Great job, guys. Okay, before we get to the questions, Monsignor Bennett's sitting out there quietly tonight. Monsignor, great for coming out, and it's always great to see you. Kirsten, you have any shout-outs?
I do. We would like to give a shout-out to Barbara Santora, June and Robin, Zena, Mia, and Marco. Thanks for watching, guys. We really appreciate it.
These guys, very loyal listeners to the show. They love Dr. Anthony Saylor. They actually, yeah, they said that they love him. He's a great doctor. He'll be on our show actually November 20th. So those keeping score, want to see Dr. Saylor, he'll be here. Now, tonight's topics are internal medicine, geriatric medicine, and rheumatology. The number to call is 718-499-6101. Also, email your questions to Ask the Doctor at netny.net. Let's go to our phones, Kirsten. We have anybody knocking down the door here?
We do, actually. On line 1, we have Jeff, and he's from Seagate, Brooklyn.
Oh, this is a great neighborhood, Seagate. Hi, Jeff.
Yeah, how you doing?
How you doing? Tell us a little about Seagate. I always liked the way that was gated. They have a fence to go in.
Yeah, it's a gated area.
Yes, it is.
It's by
What's
Coney
your name?
Island. It's old rustic houses. I'm on the water. I live in a Kennedy house, like house, mansion in Hyannis by the water. It's beautiful. It has good security. It's very expensive real estate.
It's really amazing. If people see that neighborhood, they can't believe it's so close to us here. Excellent.
So like the country and the city, you got once we could switch you off. You could be in a city and switch you off to be back in the country, sort of like by the waterside.
Beautiful. What can we do for you tonight?
Well, it's for rheumatology. I want to know if there's any new disease-modifying drugs for osteoarthritis. I know they have for rheumatoid arthritis or gout, but they've been experimenting with calcitonin, stem cells, even extract from pomegranate. Has anything come up yet that could have disease-modifying?
Yeah, that's an excellent question. You're right. There are disease-modifying medications for rheumatoid arthritis, but as of yet, we do not have anything that is a disease-modifying drug for osteoarthritis. We don't know how to shut this thing down. It is pervasive. It's the #1 arthritis that's in the United States of America, and it's causing so much morbidity and mortality as we're getting older. There is nothing available, and unfortunately, I have to state that more and more people are using pain medications for this disease because we're living longer and we have pain. And
so we're masking. We're masking.
And you know what the #1 drug in the United States is, right?
Aspirin?
No, it's Vicodin.
Huh.
Vicodin is the #1 sold drug in the United States, and because a lot of people are in pain, and you have to be very careful. And you've seen in the news a lot of people on medications, opiates, and we have to be careful because there is a large tendency for addiction to these medications. But unfortunately, again, there is nothing new.
How old is Jeff? Jeff, how old are you?
60.
Yeah, so
I work out.
You play sports, Jeff?
Shape. Beg your pardon?
You play sports?
Yeah, I do martial arts.
Oh, so.
I do 25 years.
All right, so we don't have no good news right now.
No, but the thing is, what about degenerative disc disease? Anything with that? Do you have any improvements with that?
Degenerative disc disease. Say again.
Yes.
Again, the problem is as we get older, we don't repair as well, and it takes a longer time to repair ourselves. So we don't repair as well, and it takes a longer time. We have to find ways of repairing better, so to speak.
Thanks a lot, Jeff, for the call. Take care.
Good luck.
Okay. What do we have next?
All right, well, really quickly, I want to tell everyone out there that if you call and you get disconnected, just keep calling back. We're having some trouble with one of our lines, so don't worry, we're going to get you in. And if anything, just email us at askthedoctor@netny.net. So our next caller is a very loyal viewer. On line 4, we got Joe.
Oh, Joe Stiles for his weekly
Joe.
call. Hey, Joe, how you doing?
All right. How you doing?
How is everything, Joe?
Lorenzo.
Yeah, he always looking. He knows all the people.
Joe. Bad congestion, and I'm taking.
Listen in. Let's listen in.
And I'm taking an antibiotic.
He's taking an antibiotic.
How you doing? All right.
Joe.
Yeah.
Joe, listen. We wish Joe well. I think there's technical difficulties with that line, so we're going to have to move on. But Joe, call back.
Okay, next on line 2, we have Jane, and she is from Middle Village, Queens.
Oh, nice area. Hi, Jane.
Hi, how are you?
How are you? Talk up a little bit tonight.
Okay, how are you? I like your new format, your new show.
Oh, you like the new format?
Yeah, it's very interesting. I like it. Very informative.
What do you think about the contrast of the dark furniture on one side and Kirsten all lit up over there? What do you think?
I like that.
So, good feedback, good feedback. Tell us a little bit about what's on your mind tonight.
I wanted to ask you, I went to endocrinologist, right? And I told you all along I have thyroid problem.
Yes.
Okay, finally he believed that I had thyroid. He said I have, my thyroid function is normal, but the hormone is low. What does that mean?
Okay, the thyroid function is normal, but her hormone level is low. What does that mean?
Can you just elaborate a little bit on this, Jane?
Well, he gave me Synthroid.
So the thyroid, your doctor told you that the thyroid function is normal?
He said it's normal, but it functions low.
Thyroid function is low, right? And which hormones are normal?
I don't know. He gave me Synthroid.
He gave you the Synthroid. Usually we judge, most of the times we judge the thyroid function based on a level of hormones. And in general, if the thyroid hormones are low, the doctor will give you the supplements. So the Synthroid that you've been taking is in fact the hormone.
So I guess that's the one that's low, right?
This is
what's low?
Yes, exactly. So the hormone that is low, you're getting as a pill to supplement your lower thyroid function.
Right.
You know what? So do you have any advice?
No, advice usually is once you start taking the medications, you have to make sure that you take it every day. And we usually repeat the blood work to assess the thyroid function in about 3 months. This is how long it usually takes for that specific dose of hormone to take its full effect.
Just for those people out there who may have hypothyroidism, low thyroid, what are some of the signs they should look for, Dr. Cassina?
They may feel fatigued. They may start gaining weight. The skin may become dry and they may feel cold all the time. They may develop severe constipation, hair loss. So this is some of the symptoms that you should look for. And if you have one of those or all of those symptoms, definitely please speak to your doctor.
Okay.
Oh, and I have the answer to the quiz.
Oh, which one?
Excellent.
Both of them.
Okay, so which one? You do one of them. Take which one you like.
Okay, the Pope is John the 23rd, and the other one is Pope Paul the 6th.
Okay, now wait, we got to get it to our judges out there to see if they agree with this. Judges, is that the right answer? All right. They want to hear it one more time. They're saying that they're not sure what you said. They want to hear one more time.
Okay, the first Pope is Pope John the 23rd.
That's your final answer on that one?
Yes.
Okay, next.
The next one is Pope Paul the 6th.
The 6th.
Right.
I don't know how we got smart. How did you know that one?
My husband went to St. Jerome's.
Okay. All right. So have you won a plaque before?
Yes, I did.
Where do you have that one?
In the living room with the other one.
You have 2 of them.
Yes, this will be my third one. I could put it in the middle.
This year you'll be a 3-time winner. How does it feel? How does it feel? She can't even put it into words. I think I remember the first time you won.
I was excited.
I remember the first time. We get jaded.
Don't forget to email us all of your information to askthedoctor@netny.net. But you already know that because you're a huge winner of this show.
Jane, what's the advice for the other people?
Keep watching the show. And
excellent.
Good advice.
Keep yourself informed. Be proactive about your own medicine and your own health.
Beautiful.
Yes,
I couldn't say it better. Great job.
Okay, so
have a good night.
Take care, Jane.
Good night.
Hi, Jane.
Okay, that was great. Now we're having a little trouble with these lines. I know because they lit it up, and then boom, they go off. So are we having? Tell them to keep trying.
Keep calling back, and we'll get to you.
She's my
translator.
translator.
Example, I got you.
Okay.
On line 3, we have Pat, and he's
Pat
from
there on
Park
line?
Slope.
Hi, Pat.
How you doing, Dr. Gardner?
How you doing?
Good, not bad. Very hard to get through to you the last few weeks.
I know this show is getting too popular. We have to do something to cut that out. I don't know what.
Yeah.
Maybe
Dr. Gardner, I was just, this time of year I start getting the anxiety again.
Yeah.
And, it seems like my whole system's all messed up. I start sweating and stuff like that. Is there anything that, they got me on Zoloft, 150 milligrams, and that makes my appetite, I get a big appetite. Yeah. And I'm gaining a lot of weight. So is there anything else you could suggest I could do?
Just to recap, we know Pat's gotten worked up for heart problems, for all the problems, and it seems to be related to these, I don't know if it's panic attacks or episodes that just cause him so much anxiety. Anybody?
Therapy might help. That's sort of like how do you help yourself or what's going on with you. You know, you could, I guess, I don't know where you would find it. You would need a psychiatrist to refer you, or some agency that might help you with
every year at this time for the last.
You're saying it's seasonal. It's a seasonal problem with you.
Definitely. I've wound up in the emergency room maybe 15 times in the last 10 years at this time of the year.
That's bad. Sorry.
Pat he's good in the other times of the year. Just sure it's not the Yankees? No, that's making everybody crazy, that Yankees.
Yeah,
it was the Mets.
I don't know what's going on. It can't hit. But anyway, Pat, so what do you think, Dr. Katsina?
Yeah, I would think the medication, unfortunately, have very limited effect on panic attacks. Just please follow up with your doctor, because you may have to work with the dose of the Zoloft that you've been taking.
Right.
And you have to curb your appetite and see what, the exercise and different types of psychotherapies are very, very good. Actually, for panic attacks, psychotherapy, yes.
What sets it off? What is there? One episode, one trigger, or just many different triggers?
It's just many triggers. Mostly, it starts in my stomach, and like 25 minutes after I eat, I start to sweat, and then I got to go to the bathroom. It's terrible.
Yeah, sometimes he thinks he's having a heart attack.
Yeah,
he's gotten worked up for everything.
Right. So we just before the diagnosis of panic attack is made, we'll have to make sure that nothing else is missing. And apart from all these common diseases that Dr. Morano just mentioned, the carcinoid that can present with similar symptoms.
What is that? What did he say?
It's called carcinoid syndrome.
What is
some
that
hormone the body makes, a hormone that makes you sweat. All this thing that you're getting.
Right, and you may get some, palpitations, you may get anxiety, flashing, and so there is a very simple blood test that you can, that your doctor can check.
Okay.
So you may just want to ask the doctor, but just follow up, and I think psychotherapy should be definitely helpful.
Good luck.
I'd like to hear from others out there that have panic attacks. Just, if you have, why don't you give us a call, 499-7101.
Okay. Dr. Gardner, I just want to say hello to Big Vinny on 16th Street over there. You know, he was a little down in the dumps lately.
Big Vinny, we wish you well. We're a good fan of the show, Big Vinny.
Big Vinny, a great guy. Thanks, Dr. Gardner.
Take care, Sal.
Okay.
Pat.
You ready for the next one?
I don't know.
I think you can handle it. Okay, line one, we have Daniel, and he's from Brooklyn.
Oh.
Thank you for taking my call, doctor.
Sure, Daniel.
Okay, listen, I have a big problem because it says geriatric, and I have a question on urology, okay?
Okay, very good.
And my urologist doesn't have a clue.
Well, we have the rheumatologist here. So.
Okay, let me tell you what happened. I have a bladder that during the day, I could go 4 hours. 4 hours, no problem. But at night, every hour, I'm going to urinate. Every hour. Now, what is going on here? Why is it happening, the difference between the day and night? And what can be done about it, doctor? I'm groggy from going every night, every hour and a quarter.
You can't get a good night's sleep.
If I go to sleep 11 o'clock, I get up 12:15 exactly. The next one is 1:30 exactly. What can be done, and why is this? Thank you.
I can actually set my clock to that, it sounds like. Yeah, it's amazing. Yeah.
Right, and how old are you?
What do you think?
How old are you?
88.
88.
Wow,
oh,
you sound great.
You sound very young. Could be a lot of different reasons for that. So one is when you urinate, do you urinate a lot? Is it a large amount of urine?
No, not a lot. I get a feeling of, that I have to get out of the bed. I go out of the bed, and then I'm groggy back and forth 5 or 6 times a night.
Right. And is it painful for you to urinate?
What?
Is it painful? Do you have any pain or burning?
No.
And how long it's been going on?
No pain, no burning, nothing. No.
And how long it's been going on?
Oh, how long? 5 years, 6 years.
For about 5 years?
My doctor says aging. I says, what's going on, doctor? He says to me, aging. One word, aging. But that doesn't do me any good.
It could be a lot of different reasons. You have to make sure that you have no diabetes.
What can I do?
Sometimes the heart problems.
diabetic.
Exactly. So
that's what he might have a bladder dysfunction.
It's maybe the bladder dysfunction, and your blood glucose may be elevated at the time. That's why you keep urinating.
What if he's drinking too much before he goes to sleep?
No.
Exactly.
No, he said no. He said no.
Why is during the day no problem? That's my question.
Well, what do you drink, and what time are you drinking it?
No. What am I drinking? Nothing unusual.
Well, again, nothing from nothing, as we say in Brooklyn.
So, you know, one is possibility is a diabetes and elevated blood
Is he on
sugar.
diuretic? Is he taking a water pill?
There is there is a medication.
You say diabetes?
Yes.
I used to have diabetes. Now I'm down. It's cured.
Yeah, so you're not diabetic
No,
anymore.
no, I used to be. My
yes.
sugar now is unbelievable, 80 or 90. 80 or 90.
Okay, great, excellent. Sometimes you may take a larger amount of liquid around 7 or 8 o'clock, so by the time you go to sleep, you'll get up to urinate.
When I go to sleep, 11 o'clock.
Right.
And
So
then
let's
I'm
recap.
up at 12:15, 1:30, 3 o'clock, 4 o'clock, you know.
Sometimes when your heart is weak and your body is not able to get rid of water, there is a water retention. You can get frequent urination more at night. Sometimes you may have a kidney problem that also will make you urinate more during the day. I mean, during the night, I'm sorry. And which is most probable is that there is a prostate problem.
We've been on about an hour.
That's causing you to have that frequent urination. There is one good test that your urologist can do. It's called the urodynamic study. So they can actually check how much urine your bladder is able to contain, and when you urinate, how much is left, and how much you use actually is able to get rid of.
You know, we have to end the call, but I'm going to end it with one piece of advice from one piece. You had to give one piece to this gentleman to stop getting up.
Go see a different urologist.
Yeah.
Okay.
Urologist.
Dr. Katsina?
Yes, the urologist, and the blood work from your primary care doctor.
Yeah.
Okay, and keep warm in bed. Sometimes the cold air can stimulate you to, you know, to make you want to go. Do you keep it warm in the room?
It's warm, yeah.
All right, we'll try.
Good luck.
Good luck.
Thank you very much, doctor.
Take care. Interesting call. A lot of people at home, I'm sure, can relate to that. You know, as you age, that prostate, you can't beat it. It catches up with you. That's it. But what's the alternative, right? So we have any more calls before the break?
We do. On line 2, we have Ralph from Rockaway.
Oh, way out in Rockaway. Hey, Ralph, how you doing?
Good, thank you.
What's going on in Rockaway tonight?
Not too much. I'm giving up the Yankee game to watch you.
Oh, what was the score? You get a score on that?
No, I haven't put it on yet.
This is what I like. This is loyalty over here.
That's for sure.
What about the debate? Would you give up the debate for us?
No. Well, that's 9 o'clock. You'll be over
Look at
by
that.
then.
This is the highlight of the night, right?
That's it.
That's it.
I got a question for Dr. Morano. Last year, Bruce Garner correctly diagnosed my problem as trochanteric bursitis. And
excellent rheumatologist, by the way.
I know, and I had problems sleeping on my side, my left and my right side. So I've been getting injections with a fluoroscope from North Shore Hospital. I've gotten 3 so far, but my problem is that I can only have about 3 a year, and after I have an injection, it only lasts for maybe about 3 or 4 months, and then I have pain before I can have the next one. And I was wondering, is there anything that I can do to relieve the pain while I'm waiting to be eligible for the next injection?
There are a couple of things, obviously. Therapy is one of them. You could use things like Voltaren gel on that area, which absorbs through the skin, and it decreases inflammation in the area. Obviously, you have to protect those areas. You engage in any kind of activities where you hurt yourself? Are you running on a treadmill? You alternate the height of the treadmill? There's a couple of things that you should protect yourself from doing. But the injections every 4 months will cover a year, so I don't see what the problem with that would be.
Yeah, but if I get past 3 months, I'm lucky. And then sometimes to get the next appointment stretches it out even further. So I just wanted to know, like
therapy, ultrasound is the best thing you could do in between.
Ultrasound?
Ultrasound, yeah.
Right.
How is it out there? A little foggy out in Rockaway tonight?
I haven't even looked out the window. I'm so interested in your show.
Oh, this is great. Ralph, we appreciate that so much. You want to take a stab at the quiz?
I don't know the answer. The first one I had, that was guessed. I had an idea, but I don't know the other quiz.
Why don't we just repeat that for you quickly? Because I want to give you a shot here.
Right.
Okay, so back in 1962, at the time of the Cuban Missile Crisis scare, what was the average cost of gasoline per gallon?
About 35 cents.
Is that your final answer?
Yes.
35 cents. Oh, Ralph, you're so close. So close, yet so far away.
Yeah, right.
Okay, thank you very much.
Okay, be well.
You too.
Nice
Bye.
to hear from Ralph tonight. I think it's time to take a short break here. We've been working hard. That urine question really got you knocked out.
Got us all, got us all worked up.
This is a good time for people to call in. We have a couple of callers online, but there's some open lines now. So if you have any issues, 718-499-6101. And what if you have an email that you want to send in? I'll send it in to askthedoctor@netny.net, and we're going to get them on the air. We have a few to read tonight anyway. Remember our topics: internal medicine, geriatric medicine, rheumatology. Don't go far. We'll be right back. And welcome back to Ask the Doctor, where our topics are internal medicine, geriatric medicine, and rheumatology, where we have Dr. Margarita Kutsina, Dr. Placido Morano, and that's all. We want to give us a call at 718-499-6101, or email us at askthedoctor@netny.net, and we're going to bring these emails into discussion. Kirsten, you were just in Italy. What's the #1 site, the #1 thing you enjoyed the most?
Oh my gosh, you know, it was Venice. Just
Oh,
the whole
Venezia.
city. It was the most beautiful thing I've ever seen.
Did you go on the gondola?
I didn't. We actually took the water bus and we just drove it around. We didn't even have a stop. We waited till they kicked us off.
Did the hotel do something? Now you had the honeymoon suite, or?
Well, in Europe, the 5-star hotels aren't what they are in America. Very small.
Really?
But we didn't mind.
You don't need a lot of space.
No.
No, it's okay. All right, anyway, let's move on with the line 1. Let's see, who do we have on line 1?
It's Madeline from Flushing.
Oh, hi, Madeline.
Yeah, hello.
Madeline, how are you? You're from Flushing?
Yes.
How is that there tonight?
Hi.
That Flushing is the most
fine.
diverse neighborhood in the country. It's amazing, right?
Yeah, should I speak in? Yeah,
Let me hear you talk a little bit louder.
Yeah.
And also turn your TV down, because I can hear the TV in the background.
Okay.
Okay. Again, we're having trouble with this line 3.
Okay.
But anyway, come on back. What are we going to do for you tonight?
Oh, well, I'm a senior, and I have, I want to ask the doctor.
Okay, which one would you like to talk to?
The man doctor, Dr. Morano.
Yeah, just since you're off the air, who do you think is better looking doctor?
Thank you.
So you got the answer.
Okay, Dr. Morano?
Yes.
I'd like to ask you, I suffer with lower back pain syndrome, and also I have arthritis in my legs, and I get leg cramps sometimes in the morning when I'm getting up. That tightness in the thighs, it hurts very bad. And what is the difference between the lower back syndrome? It's 2 questions. The cramp in my leg and lower back syndrome and arthritis.
Okay, usually they could be interchangeable. Most people with low back syndrome, if you call, have degenerative disc disease to begin with. And back problems is a very common problem. It's probably one of the #1 musculoskeletal complaint in the United States to go see a doctor. So osteoarthritis, degenerative disc disease, they're interchangeable. They're the disc between the 2 vertebrae, if you can imagine, the vertebra is a bone, the disc is a gelatinous material. With time, that gelatinous material desiccates, it gets dried out, and you have increased pressures on both sides. So it could give you pain. Also the facet joints, where they connect one vertebra to the other, that could also become degenerative and cause pain. So back pain has a multitude of possible causes, as well as psychological causes. Some people get stomach aches, some people get neck pain, some people get also back pain. So that's the back. As far as the cramping in the legs, the etiology of that could be a multitude of problems. Anything from radiculopathy from the spine, restless leg syndrome, electrolyte imbalance, myopathy, even hypothyroidism, like we talked before, can have proximal muscle pain and weakness. So this all requires a workup, anything from x-rays to serological testing before you could proceed to tell you what you should do. But I will tell you one thing that's a common denominator to all of this. If you have an opportunity to swim, swim is ideal for chronic low back problems. Good luck, ma'am.
We hope that helps you.
Thank you so much. Thank you.
Okay, take care. Kirsten, so do we have any email questions while we have a lull in the action
You
here?
know what? We actually just got an email a couple of minutes ago.
Just under this.
You're right.
Under the wire.
It's from Danielle. She says, "Hi, is there a definite diagnosis for lupus? I've been told that I have it, but my symptoms don't coincide with lupus. Thanks, Danielle."
Just briefly, and I think, Dr. Morano, what is lupus?
Lupus is an autoimmune condition.
What does that mean?
Autoimmune means your body attacks itself. You're producing antibodies against yourself. In fact, one of the tests that we do screening for lupus is an anti-nuclear antibody. And then there are a multitude of tests that show what type of autoimmune condition you might have. An ANA positivity does not denote lupus.
So ANA is a blood test.
It's a blood test. And so there are a number of blood tests that should be looked at. The symptoms of lupus vary from, I always tell people there's lupus, and then there's lupus. So you could have a rash and joint pains and that's it, and you might still have lupus. Or you could have seizures, psychosis, renal insufficiency, as well as fluid around the heart, the lungs.
So it could go all the way from the whole spectrum.
Myriad of symptoms.
Dr. Kutsina?
It's a hard diagnosis to make at times, but once it is made, you have to decide what type of lupus you have and what are the treatments.
What was the question exactly? I want to make sure we answered it. Did she have a specific question about treatment?
She just, no. She was just wondering if there was a definite diagnosis for lupus.
Okay, and
no, I think the definite diagnosis is the certain clinical symptoms in combination with the serological testing.
Okay, do you have one? Because I have one over here.
Oh, no.
Yeah.
Do I have something about lupus?
No, an email.
Oh, actually, I wanted to remind everyone that we have a quiz question, an awesome quiz question, and no one has answered it yet. So you need to call in at 718-499-6101. That quiz question is, 50 years ago, what was the price of gas per gallon? Someone guessed 35. My husband emailed. He guessed. He has a quiz
what
question
did he guess?
He guessed 31 cents a gallon.
I'll give you a hint. He's getting closer.
He's getting closer, but I don't think that's the answer.
But look,
so.
Look, just
I was right. It's not.
No, but as soon as you started talking, line one got nervous and hung up.
It's true, but that's okay because Rosalie sent us an email. Are you interested in checking out Rosalie's email?
Let's hear you, Rosalie.
All right. Well, her cholesterol is 265, and she's taking Crestor. She just started. Her blood pressure has gone down lately. She's wondering how long will it take to get better. She's eating better and taking Crestor. And how long is it going to take until she sees a change is what she asked.
We usually repeat the blood work in about a month. So in about a month after starting the Crestor or any other medication for cholesterol, you should be able to see the decrease in your numbers. Now, if you don't, then you may want to speak to a doctor about maybe increasing the dose, changing the medication, and just you also will have to monitor for the potential side effects.
If you have the side effects with one, let's say with Crestor, would that mean you're going to have it with Lipitor?
No, it doesn't. It doesn't mean at all. Sometimes you'll just have to try and see which medication you'll be able to tolerate better.
Okay, I know we're having trouble with line 2 because I saw it light up and then go off.
So keep calling back,
everyone. Do the best. If not, we can. We'll just talk here because I have a question here from Joe from Queens, and he wants to know. He's a diabetic, and he's got heart failure, and he's about 80 years old, and he wants to know if there is a problem with him taking Viagra.
It's a very complex question. Because a lot of people who have heart failure have been taking certain medications that may have interactions with Viagra. So before you do, you'll have to make sure that you fit enough. And some doctors even refer the patient for a stress test to make sure that you'll be able to sustain the activity. And make sure that your medications have no interactions with Viagra.
It's also probably a good idea not to get that mail-order pharmacy.
Well, yes, absolutely. You'll have to get if you are to get the prescription, make sure that you get a prescription from your doctor.
Yeah, that can be dangerous. Even though it's easy to get now, it can be dangerous.
Right.
So it's good point. We have someone on line 1.
Yes, we have Gary from Canarsie on line 1.
My old stomping grounds. Hi, Gary.
Yes, hi.
How you doing? Gary, talk up a little bit louder.
Yes. I'm here. You hear me now?
I hear you now. What's doing in Canarsie?
I'm in Star City, Brooklyn, USA.
Yeah, no, I spent a lot of time there when my kids went to school at PS 276 in Bildersee.
Okay.
All right, I got a little laugh. I don't know. It's not. What can we do for you?
I have a question. I keep developing the kidney stones.
Yes.
For the past 10 years, I had 3 procedures done on me, and right now I have a stent. I was wondering if there is any way to avoid the the stone development or making the stones.
So he keeps getting stones. He's to the point now where he has a stent in his ureter.
Right.
What kind of stones?
Well, they're uric acid.
Uric acid.
Okay, so that's, we can definitely, you can try to avoid it by, one is hydration. Your urologist or your rheumatologist or the primary care doctor should be able to check the uric acid level in your blood. There is also certain medications that can lower the uric acid in your blood and thus decreasing the chances of your getting the kidney stones.
Any thoughts?
Okay, there's a funny thing. I went for a procedure a couple of weeks ago. They were supposed to do a procedure on my kidney stone, which is 3 centimeters. The size is 3 centimeters. Now, when that
How many?
3 centimeters?
Centimeters or millimeters?
3 centimeters.
3
Oh,
centimeters?
you can't pass that. Yeah.
That's a brick.
You can't pass that. So what did they do? Lithotripsy?
They were supposed to do it, but for some reason they couldn't find the stone at the time. They had to let me go.
Really?
No, it's not. It's very
Something's
unlikely.
not. Yeah,
It's
something's not kosher.
Because that kind of the stone of that size is not able to pass.
Yeah.
So
you won't be able to get
Stones
rid
of
of the
5
stone.
millimeters and above, you can't pass.
Right, absolutely. And 3 centimeters, this is an enormous stone.
Yeah. That's a
I
brick.
know. I
Yes.
passed a lot of stones. They were like 2 millimeters, 3 millimeters,
Right.
and I saw them.
The only thing we could say to you is the treatment right now is obviously to break this apart and try to get it out of you, which your urologist is supposed to help you with. As far as from the medical point of view, we have chemicals that, like Uloric, that can do this for you, but you need to definitely see your doctor.
So why don't you give him a call and find out what the size of the stone was? Call us back next week, all right?
Okay, I will.
Okay, I'm gonna try that line 3. Can I try that, Kirsten? Because I see it keeps lighting and goes away.
Is it there right now for you?
Yeah, try
It's,
to.
right now it's now dark for me. Let me see. Yep,
I think it was Joe.
it's Joe Stiles. Joe, keep trying. Okay, and finally on line 1 before we go to break,
Yes, line 1 is Annabelle from Brooklyn.
Annabelle. How are you, Annabelle? Annabelle?
All right.
Okay.
Let's take a break and maybe she'll call back.
Okay, so what we're going to do is we're going to take a short break, and when we come back, we're going to try and take more of your questions. The topics are internal medicine, geriatrics, and rheumatology. The phone number is 718-499-6101, or email us at askthedoctor@netny.net. Good time to call in right now. We'll be right back. Welcome back to Ask the Doctor, where our topics are internal medicine, geriatrics, and rheumatology. The lines again, and we're having, nothing's perfect. With technology, we're doing our best, but they're not quite working right, so you just keep calling, though.
Emails are working.
And emails are working?
Getting a lot of emails.
We didn't turn the internet down with the, flush everything down. So what do we have? Let's go to an email first.
Oh, perfect. Actually, Lucille wanted to let you know that there's no score in the Yankees game. It's 0-0.
Lucille, thanks a lot. I knew the Yankee score without even asking.
Yakov, he has an answer to the quiz question.
Yakov, is he on line 1?
No, it's an
email. It's an email response.
Yes, he asked if it was 28 cents.
Oh, could that be possible? Could the average cost of a gasoline, 1 gallon, be 28 cents in 1962? Whoa!
I have a feeling you were so close, though.
So close, so close.
Keep calling in, people. Someone's gonna win.
What was that song? So close and yet so far away. Remember that song, Frankie
You have
Valli?
a really good voice, Dr. Garner.
I almost heard it. Yeah. Who's on that line 1 flashing? I'd like to try and grab that line.
You know what? Let me see. Ask the doctor. Ask the doctor.
Look, this is the behind-the-scenes activity. Look at the way the phone calls are answered. It's a good opportunity to see something.
Perfect. It's Annabelle. She got cut off earlier.
All right. Let me see if we can get Annabelle. Tell her not to go anywhere.
Okay, Annabelle. Here you go.
Let's see. Annabelle?
Yes, I'm here.
Oh, Annabelle. Great.
I'm here.
You made it. You made it feel like you got through a snowstorm.
I'd like to get a lipo done.
You know, is that Annabelle's voice morphed into another caller? What was that?
No, that's me. That's Annabelle.
You're Annabelle?
Yes, sir.
No, it's a beautiful name. Thank you. What can we do for you?
I'm sorry?
What can we do for you?
Yeah, I'm thinking I'm a diabetic. I have a 42-inch waist. I'd like to get a lipo done.
Okay.
And I'd like to know if there would be a problem with it, that being a diabetic, insulin dependent.
And you wanted liposuction as opposed, how much do you weigh overall?
225. I'm
okay.
5'10".
Is liposuction a contraindication for diabetics?
Yeah, I think it is, because any doctor, if you go to the plastic surgeon, and they're supposed to ask a medical history, and diabetes definitely is a contraindication to the liposuction only. You may be the candidate for any other procedures, weight reduction procedures, but for the liposuction alone, you definitely carry the higher risk of developing any infections after the procedure, or even based on whatever other medical problems you have, there may be something else, maybe heart attacks or strokes. But definitely the problem with the healing of the incisions may definitely affect your recovery. So what I would say is liposuction is contraindication.
Annabelle?
Yes, sir.
So it doesn't sound like you're going to be a good candidate for liposuction. You want to get a shot at the quiz?
Yeah, but I'd like to know what's the other procedure.
And so the next step, you may be the candidate for weight reduction procedure, such as maybe the bypass or maybe the lap band. But it's usually done as a last resort. First is diet and exercise under the supervision of your doctor or your endocrinologist.
He was only 225.
But so I think it's with 225. And how tall are you?
5'10".
5'10"?
Yes.
Okay, so yeah, I think you should be a very good candidate for diet and exercise alone.
Yeah,
and you should do really well with that.
Well, we're not giving you an easy way to do it.
So there is liposuction is not for you.
Good luck.
You want to take a shot at the quiz so you know figure the whole night's not a loss?
I'll stop that.
What's the price of a gallon of gas in 1962?
69 cents.
69 cents. Is it 69 cents? All right, Annabelle, night it was a total loss, but call back, keep us aware of what's going on. It's good to talk to you.
Dr. Garner,
have a good night. It's been a pleasure.
Take care.
Night. Bye, Annabelle.
Bye, Annabelle.
We have Madlon on line 2, and she thinks she knows the answer to the quiz question.
Oh, and her name is Madlon?
Madlon.
Madlon.
Yes, hello.
I love the name. Where's it from?
It's a French name.
French name.
I'm from Bensonhurst.
What is it? Oh, I should have picked that up. So what is it? What does it mean, Madlon?
Madeline. It means the woman of Magdala, Mary Magdalene.
Wow, this is great name. Great name.
Thank you.
So beautiful voice. I like the voice. Infectious laughter. Don't you feel like laughing?
Absolutely.
That smile. So let me see it.
Thank you.
So what can we do for you tonight?
Well, I'm calling to say about the answer, but I do have a question. Maybe it's geriatric. I'm not sure. Years ago, I had a few surgeries that left a flap from hysterectomy and bladder cancers. Now, the flap is so large that I'm developing almost like a crease across the lower abdomen that actually sometimes can bleed and ooze. And I was wondering, is there a follow-up surgery to correct that flap of skin that's there, or is it just better to maintain the surgical area that's been, you know, that's...
So this is definitely, it's not a normal development. How long ago did you have a surgery?
About 16 years ago.
15 years ago. So by now your the scar, you know, it should be healed by now, with no evidence of any kind of, you know, bleeding or infection or oozing. So if you do have those symptoms, you'll definitely have to, you know, ideally you may see the surgeon if he's still available, the one who did the procedure, or you can even start, the primary care doctor would be the good person to start from, and he or she'll be able to direct you to the appropriate specialist.
So Madeline?
Yes.
Now we're ready for the answer to the quiz.
Yes, 25 cents.
Okay, wait, can you take a step back and say that one more time?
25 cents.
Is it 25 cents? Madeline, you have the studio is something to cheer about now. Finally, we've been sitting here.
Thank you. Unbelievable.
25 cents. What made you guess 25 cents?
ESP.
That's a different
yes,
station.
a good one.
No, but that's, is this your first, are you a one-time winner, first-time winner?
First-time winner.
Do you have a place put aside?
Yes, I will. I do have one right in my dining room.
You have the plaque in mind? You can just picture it in front of you?
Yes.
Beautiful. So don't go, you're going to call, what does she have to do, Kirsten?
Okay, Madeline, you need to email us all of your information at askthedoctor@netny.net. Thank you so much. Good job.
Thank you.
Great to talk to you out
You
there.
did a good job tonight, too, all of you. Thank you.
Thanks
Bye.
a lot. No, we came through it together. I mean, we had a little trouble with the phone lines,
Right.
but now we got a full house. Let's try and squeeze one more in.
All right,
Can
we have
squeeze-
Linda on line 4 from Staten Island.
Linda is here. Hi,
I think she's going to answer the quiz question.
Linda.
Hello.
Hi, Linda. Linda, you have to turn down the TV.
Well, you know, I have an email too, because I think she's going to
Let's take the email while waiting for Linda.
Okay, she had a CAT scan done recently. This is Jalissa.
Okay.
And it showed nodules on her lungs. And she just recently started to feel pain on her chest. The doctors wanted to take another scan, but she doesn't want to do another one. What do you suggest is the best thing to do?
I would suggest that the pulmonary nodule is maybe very, very dangerous, and it definitely requires very close follow-up. So I would suggest you do is just please speak to your doctor and just try to explain, you know, what's your concerns about doing another CAT scan, and your doctor will be able to address your problems. But please follow up and just don't disregard your doctor's advice.
Thank you. Okay, now who are we waiting for?
For Linda?
For Linda?
No, Linda, she missed out. She missed the
Oh,
vote.
it was too much for
on
Linda.
the quiz question.
But I see we have one last caller on line 3. Could it be Joe Stiles? Hello?
Hello?
Joe,
Hello.
Joe, I can't. There's no time. We got to get out of here. But thanks for trying.
Thanks,
okay?
Joe.
And again, thanks so much for coming in, Dr. Morano, Dr. Katsina. Really, two of my favorite guests on the show. Thanks for bringing it through.
Thank you very much.
I can't believe the episode flew so fast. It seems like only 2 hours. I want to thank Dr. Kirsten. Oh, no, I should give you, not yet. Now, it's good to remember you should always be proactive about your health. Speak to your doctors about your concerns. Go for second or third opinions if you have to. And if the teleprompter worked, I would tell you to visit our website at netny.net/askthedoctor. And also, tune into the tablet. You know, you can look at it on the website, or you can read it when you get it in church. And you can watch past episodes. You can email questions to us. Do brain quizzes. Thank you for everything. Thank you for all your questions tonight. And for next week, we're going to discuss urology and more internal medicine, geriatric medicine, and lung disease. Now, also, don't forget to tune in tonight at 9 o'clock for the encore presentation of last week's show. That was the church show, the Church of the Virgin Mary. We'll see you at 10 o'clock. I want you to goodbye, stay healthy. Good night, everyone.